Okay, my name is Jessica. I'm going to be doing a full head to toe assessment on you today. I'm going to touch you. Is that okay? Mm-hmm. Okay, I'm first starting off looking at the skin. I'm looking at the color, temperature, turgor, texture, moisture, looking for any signs of bruising, scars, lesions, nevi, or edema. I'm going to start out looking at the head. It's normocephalic in midline position. I'm going to feel your scalp. The hair is evenly distributed. Looking at the color, the texture, feeling for any masses, any tenderness, depressions or infestations, which are none. I'm going to come down and feel your temporal arteries, any tenderness. Perfect. And from here, I'm going to feel your lymph nodes. So the preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and the supraclavicular. I'm going to, from this point, test your cranial nerve 5 motor. So I'm going to have you feel your masseter muscle, have you clench your jaw. Perfect, symmetric. And then I will have you close your eyes and tell me where on your face you feel me touch.
Forehead, cheek, chin, nose.
Perfect. Cranial nerve 5 is intact. And then if you'll look at me and puff out your cheeks, smile, frown, poke out your lips, and raise your eyebrows. Cranial nerve 7 is intact. I'm from here going to move to your ears. I'm starting by inspecting. They're both symmetric, and then the correct position, palpating the pinna and the tragus. I'm going to look in the auditory canal, looking for the tympanic membrane. It's pearly gray and translucent. Looking for this one is pearly gray and translucent also. Both cone of lights were present. I am going to perform the whisper test. So if you'll include this ear and repeat after me.
1, 2, 3.
And move to the other.
3, 2, 1.
Perfect. Then I'm going to perform the Weber test, testing for lateralization of sound. Have you tell me if you hear this in one or both ears.
Both.
Okay, and then I'm gonna test, do the Rhine test. Tell me when you stop hearing this, if I don't break it.
Now.
Okay.
I don't hear it. I don't hear it anymore.
Perfect. Air conduction is greater than bone conduction on both sides, and cranial nerve 8 is intact. From here, I am going to move to your eyes. I'm going to be looking at your eyebrows, your eyelashes, your palpebral fissures. I'm going to raise up your glasses for a second. Looking at your conjunctiva, your sclera. There's no signs of any drainage or discharge. I'm going to test your gross visual acuity. If you will, you can use your corrective lenses. Sorry. If you will, read the lowest line, including one eye.
EDFCZP.
Okay, and then other eye.
EDFCZP.
Okay, she has 20/20 bilaterally with corrective lenses. And then if you will, look straight ahead at me and tell me what number I'm holding up.
4, 2.
Perfect. Central and visual acuity are intact. Cranial nerve 2 is intact. Then I'll have you look at my nose. Perfect. Pupils are equal, round, and reactive to light. An accommodation, if you will, testing for accommodation and convergence, follow the pin in. Perfect. And then I'm going to test your extraocular movements, if you will, follow my pin with only your eyes. Thank you. And coming in. Perfect. And I'm going to check the red reflex. Okay. Red reflex is present with optic disc is seen with no signs of hemorrhage or abnormalities. From the eyes, I'm going to move cranial nerves 3, 4, and 6 are also intact. I am now going to move to the nose. The nose is midline and symmetric on the face. I'll have you occlude one side and breathe in and out. Other side. Sorry. I'm going to palpate your frontal and your maxillary sinuses. Any tenderness?
No.
Okay. And then there's no signs of any discharge or anything. From here, I'm going to move to your mouth. Have you open up? I'm looking at the lips, the teeth, the gums, the under the tongue, the buccal mucosa, the salivary glands, the palate, the posterior pharynx. Stick out your tongue and say ah.
Ah.
Cranial nerve 9 and 10 are intact. The soft palate and uvula rise with phonation. If you will also stick out your tongue. The tongue is midline without fasciculation, so cranial nerve 12 is intact. Now I'm going to feel your for TMJ. If you'll open your mouth and move it side to side. Any tenderness?
No.
No signs of crepitus or subluxation. From here, I'm going to move on to your neck. Looking at the skin, it's warm, dry, and intact. Your trachea is midline. I'm going to come behind you. Your thyroid gland, if you'll swallow, there's no masses noted there. I'm going to palpate your carotid arteries. Perfect. Now I'm going to auscultate for any bruise with my bell. Perfect. And then I am going to have you do range of motion. So if you'll flex, extend, hyperextend, lateral flexion, and then rotation. Perfect. And then testing cranial nerve 11, will you shrug against my resistance? Perfect. I'm now going to move, if you'll kind of turn this way, I'm going to look at your posterior chest, first looking for any signs of respiratory distress, accessory muscle use, tripod, nasal flaring, cyanosis, or tachypnea, which I see none. The chest is symmetric with no signs of obvious deformities. I'm going to begin by testing chest expansion. If you will take a deep breath. The chest is symmetric. Can you see the butt? Yeah. Sorry, the chest is symmetric. And now I'm going to check for tactile fremitus. If you will say 99.
99, 99, 99, 99.
Perfect. And then I'm going to percuss over the lung fields and the intercostal spaces. And then I am going to auscultate. Take a deep breath. Perfect. And now I'm going to test for egophony. If you will, say E every time you feel the stethoscope placed.
E, 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 E.
Okay. And then test for bronchophy. If you'll say 99.
99, 99, 99, 99, 99, 99.
And then whisper pectorilically. If you'll whisper 1, 2, 3.
1, 2, 3.
Okay, perfect. And then I'm going to have you turn around and I'm going to move to your anterior chest. Again, starting looking, there's no signs of respiratory distress. Skin is warm, dry, intact. I'm going to test for symmetrical chest expansion. Take a deep breath. Perfect. Tactile fremitus, say 99.
99, 99, 99.
Perfect. And then I'm going to auscultate. Just take deep breaths when you feel in the stethoscope. Perfect. Now I'm going to move on to the cardiac. I'm going to start by palpating the valves. Auscultating the valves. We're going to start at the second intercostal space, right of the sternal border. It's the aortic. Then the pulmonic is second intercostal space, left of the sternal border. Herbs is third intercostal space, left of the sternal border. Tricuspid is fourth intercostal space, left of the sternal border, and then the mitral is 5th intercostal space, mid-clavicular line. This is also where I would listen for a minute for the apical pulse, noting the rate and rhythm. And this is also where I will palpate the point of maximal intensity or maximal impulse. Perfect. I'm also going to listen to all those areas again with my bell. So we have aortic, pulmonic, herbs, tricuspid, and then the mitral. Perfect. I'm going to have you lie down at this point. At a 35-degree angle, I would look for JVD distension or pulsation, which I saw none. Now that you're lying flat, I'm going to inspect the area. I see no heaves or lifts. I'm going to palpate, feeling for any thrills, aortic, pulmonic, herbs, tricuspid, and the mitral. I'm again going to listen to all the fields with both my diagram and my bell. So aortic, pulmonic, herbs, tricuspid, and mitral. And swap over. Aortic, pulmonic, herbs, tricuspid, and mitral. Perfect. I'm then going to move on to the abdominal assessment. I'm going to lift up your shirt. I'm going to look warm, dry, and intact skin with a few nevi loaded, no scarring or bruising or edema. The umbilicus is midline. The abdomen is symmetric. I'm going to start out by auscultating for any bruits using my bell. Aorta, renal, iliac, and femoral. And then I'm going to listen to bowel sounds starting in the right lower. Okay. I'm now going to percuss. Listening for any tympany, dullness, or flatness. I'm going to palpate. And then palpate the liver and spleen, which I do not feel any enlargement, any tenderness.
Oh.
Perfect. At this point, I'll have you sit up. And I'm going to palpate for any CVA tenderness. Any tenderness?
No.
Perfect. From this point, we are going to move on to the upper extremities. I'm gonna start with your fingers. Looking at the joints in your fingers, looking for swelling, tenderness, crepitus, nodules, redness, any asymmetry, which I see none. Also looking at the wrist for the same things. Both elbows, all the joints. There's no redness, swelling in the shoulders or any asymmetry, nodules, anything found. So your fingers again, I'm gonna feel cap refill is less than 3 seconds and palpate your radial arteries. Perfect. Okay, so now we're gonna do some range of motion for your fingers if you'll just follow me. Flexion, extension, hyperextension, adduction, abduction, and thumb opposition. And then your wrist, flexion, extension, hyperextension, radial deviation, ulnar deviation, and rotation. And then for your elbows, flexion, extension, hyperextension, your shoulder, flexion, extension, hyperextension, adduction, abduction, internal rotation, external rotation, and circumduction. Perfect. Now I'm going to test the strength if you'll squeeze my hand. 5 out of 5. For your elbows, your biceps and triceps, if you'll pull against me, push against me. Perfect. 5 out of 5. Your shoulders, if you'll adduct in. 5 out of 5. Abduct out. 5 out of 5. I'm now going to test your sensory function of your upper. If you'll close your eyes and tell me where I touch.
Arm, elbow, arm, hand. Sorry.
Okay. And while I have this out, I'm going to do your lower extremity sensation as well.
Okay. Leg, right leg, left leg, foot.
Perfect. And I'm going to test for vibratory sensation. Placing it in the proximal ulnar prominence. Do you feel this?
Mm-hmm.
Do you feel this?
Yes.
Do you feel this?
Yes. Yes.
Perfect. Now I'm going to do your deep tendon reflexes, starting with your brachioradialis, your biceps, triceps, this one, and then you cross your legs, your patellar, your Achilles, and then Babinski, and then, patellar, Achilles, and then Babinski. Now I'm going to move to your lower extremities, looking at your toes. The joints are all symmetric, no redness, swelling, nodules, crepitus, or asymmetry noted. I'm going to palpate your dorsalis pedis and your posterior tibialis pulses, which are both normal. I'm looking at your ankles. There's no redness, swelling noted, or crepitus, any tenderness in any of your joints.
Yeah.
Your knees are also symmetric, no redness, swelling, anything noted. I'm going to have you plantar flex against my resistance, dorsiflex against my resistance, perfect. And then flex your knees, extend your knees, and then abduct your hips. And then abduct your hips. Yeah. I'm then going to revert back and have you do serial finger opposition. So if you will, and then place your hands on your legs and flip back and forth. And then touch your nose to your finger and touch my finger. Perfect. I'm now going to have you stand up. We're going to do the range of motion of your lower extremities. So flex your knee, extend, hyperextend, flex, extend, hyperextend. I'm going to have you flex your your hip, extend, hyperextend, flex, extend, hyperextend, internal rotation, external rotation, internal rotation, external rotation, and then circumduction. And then I'm going to palpate your hips. No redness or swelling noted. I'm going to feel your spine. Looking for the normal alignment. If you will, lean over for me. No signs of scoliosis, redness, or tenderness. So while you're here, this is flexion. You'll stand up and extend. Hyperextend, lateral flexion to each side, and then rotation. Perfect. I'm going to have you walk away from me regularly, and then walk back to me heel to toe for tandem. And that is normal. I'm going to have you stand still and close your eyes looking for any swaying. Perfect, no swaying. And then I'm going to have you hop on one foot and then hop on the other foot. And I missed one thing, so if I'll have you sit down one more time, and I'm going to do your toes. If you'll flex, extend, abduct, adduct. And then for your ankles, you're going to plantar flex down with both, dorsiflex up, rotate, inversion, eversion. And that concludes our physical assessment.